Welcome back to Unraveling the Brain. I am your host, Dr. Josh Madsen. Today, I am going to be chatting with Dr. Jordan Shilts, and we are going to be chatting about hyperbaric oxygen therapy, mitotherapies, mitochondrial dysfunctions, and all types of fun things that relate back to not only kids that have developmental challenges, but also kids that are people that have chronic diseases, chronic inflammatory issues, and much, much more. So let's jump into it.
Yeah,
What's up, man?
Thanks for having me.
Well, thanks for being here. Yeah. So let's start with, I want to talk about hyperbarics because you own a hyperbaric clinic. So you know a lot about it, way more than I will ever know probably. But let's jump into that. Explain to people what hyperbarics is, positive effects of it, what the biggest systems it affects are, and why it's important for therapies.
Awesome. Yeah, so as we all know, oxygen is key for life. It's really how our cells produce energy once the oxygen gets into the mitochondria and produces ATP. So the way that we breathe naturally is because our atmosphere is pressurized. And so the pressure forces the oxygen into the lungs and then into our blood, which then goes to the target tissue. So under normal resting conditions, once the oxygen gets into the bloodstream, it's going to attach itself onto a transporter, the red blood cell, and then again go to the target tissue. So what we're doing with hyperbarics is we're manipulating this outside atmosphere and we're increasing the amount of pressure to do two things. We're going to increase the amount of driving force into the tissues, but what's also going to happen is that when a molecule, such as oxygen, is under pressure, it's going to shrink in size. So now it no longer needs that transporter to be able to go to the target tissue. It can just freely dissolve directly into the blood, which is really cool, or to the plasma. So now essentially we have this unlimited reservoir where our cells can take in all this oxygen, and then we can have more oxygen into the mitochondria producing more ATP.
Which we need ATP for about everything. So yeah, and that's why I really like utilizing it for, kids that have developmental challenges, or especially ones that have mitochondrial dysfunctions. We use it a lot to just increase oxygen to our system so we can produce more ATP, so rehab goes smoother. But you don't have the same type of clinic that you're currently in. For everyone that doesn't know this, Jordan is going to be joining our team for our Minnesota clinic, or currently is, but it's going to be full-time by the end of the summer. But currently you have a clinic, and what else do you use it for?
So we use it for primarily neuropathies. So again, a lot of mitochondrial dysfunctions, a lot of high demands in the nervous system.
Vascular injuries and...
Exactly, yeah. We use it for strokes, and then also pre and post-surgical. There can be a lot of things. If you think about surgery as a planned trauma, there's not a lot of times you get the opportunity to really optimize the environment and the cellular healing environment to undergo a trauma and then heal up to like 50 times better. It's really, really fascinating.
That's super cool. What's the coolest things you've seen?
Really cool autistic changes with just expanding behavioral abilities and behavioral adaptations has been really fascinating. Yep. Strokes have been also really, really big. It's obviously a lot better as you come in sooner and not delaying. And then sudden hearing loss is that's an FDA approved condition as well. So we see it's kind of a scary thing to wake up and all of a sudden you can't hear out of your left ear. So
yeah, for sure. That's wild.
Those who get on top of it right away see a lot of good improvements, even in 2 weeks.
Yeah, that's super cool. What's the, since you guys just do you do a lot of other stuff prior to hyperbarics, which I want to talk about, different testing you do, but a typical treatment plan is, what does that normally look like for your hyperbaric clients, and what's the most ideal? What's the research show on the most ideal methodologies for it as well?
Yeah, so the gold standard traditionally is a lot of things that you'll find in the research is 40 sessions, and we like to compound those sessions as close together as possible. So in our clinic, we'll do 2-week intensives, 4-week intensives, and 8-week intensives. What that looks like is 10, 20, and 40 sessions. We'll ideally do those 4 to 5 times per week, and dosed at either 60 minutes or 90 minutes, time under pressure.
And then you had once talked to me about, you guys do a lot of functional medicine testing prior to. Describe what you do that for and why you do it and why it's important for people doing hyperbarics or that are going to be doing hyperbarics, why it's important to run those different markers. I think that was a really cool conversation. I think a lot of people deserve to hear that answer.
Yeah, so it's a lot better if you can really, or it works a lot better if you can really optimize the environment prior to flooding the body with oxygen. Similar to working out, right when you start, if you were to just jump right into it, you're going to have a lot of sore muscles, potentially injuries, and you're just not going to get as best outcome as you can. So tying this back to hyperbaric, specifically in like peripheral neuropathy or diabetic neuropathy, if there's an underlying glucose issue and just a cellular energy issue, your body's not going to be able to process that energy quite as well, and you're just not going to get as best outcomes. So we've seen this in the past where we have individuals just come in, they Google hyperbaric and say, look, man, this is going to be a huge silver bullet. It's going to fix all my problems. Go through, 2 to 4 weeks and don't see a lot of changes. Whereas then, we start to work on the underlying metabolic issues, really balance out blood sugar, and then pop into hyperbaric. See so much better outcomes from that.
That's cool.
Specifically improving like sensory function specifically is really, really big once you get that foundational level worked on.
Yeah. Yeah. You can go get all the oxygen in the world and you go home and just your blood sugar spikes again. Now you just re-injured the tissues again anyways. So, and we see the same thing with kids, like with coming here for intensives, if they've taken weeks or months prior to and really built up a foundation of appropriate nutrition and getting inflammation down and regulating their blood sugar, the results are so much better, and I feel like the same with every kind of therapy. But anything you want to add on hyperbarics? What are things that most people don't think about with hyperbarics, things that, conditions that can be helped through hyperbarics that you've seen? Let's chat about that. And then I want to go into mitotherapies.
Yeah. So it's one of the things that it doesn't really cure anything. We see a lot with if you're looking at carbon monoxide poisoning, that's kind of like one of the main emergency things that you absolutely have to get into a chamber for. But other than that, it's not really curing anything, but it's helping improve so many processes by way of just increasing ATP through the mitochondria. So you're going to see that's why we use it a lot with pre-post-surgical. That's why we use it a lot with just a lot of things, because it's such a phenomenal tool, again, if the body's in the right environment to be processing all of that oxygen. But yes, a good question. Some common misconceptions or some things that a lot of people don't know about hyperbarics is that the American way is to think that more is always better. And that's one of the primary things that we've seen in the last 5 years is really tailoring a specific pressure towards a specific individual over a period of time. So what that can look like is if you are in an environment where you're pretty susceptible or sensitive to oxidative stressors, jumping into the highest pressure and doing that, multiple times per week is not going to go well. You're going to see regression. You're going to see, some symptomatic changes. So that's where it's really helpful to be at a place that, kind of really understands what they're doing and tailoring protocols to you with a pretty good in-depth knowledge. And also that's where some of the labs come in too, so that you can identify some of those potential cellular oxidative stressors.
Yeah. So then you start out, from what I understand, you guys have soft chambers all the way up to hard chambers, and you start off with a lower pressure because if the environment isn't correct, you're not going to be able to absorb that oxygen anyways appropriately and utilize it. So you start off slower, and then as those labs or as those mitochondrial function improves, you increase the pressure. Am I correct in saying that?
Yeah, for the most part, yeah.
Yeah.
And specifically in this population too, with autistic individuals, with even nonverbal, verbal, or any neuromotor development, specifically within the nervous system, it doesn't take a lot of pressure to be able to force that oxygen into those tissues. Being that the nervous system is mostly made up of water, that's where you're going to see a lot of the research being between 1.3 and 1.6, 1.7 for really autism, kind of that 1.3, 1.5 probably being the most beneficial. And what we're going to do to hedge that is then go more towards frequency. I'm actually a bigger fan of frequency than I am pressure, and for a lot of improvements that we see with that.
Yeah, that's cool. Yeah, and the chambers that we only have soft chambers, because I remember reading, like when I first started looking into all this, for neurological health, it seemed that those lower pressures seem to do really well for kids, and also just being easier to do. So then we jumped into that. But
yeah, it really ties back into, a lot of this population, we're dealing with neural inflammation and a lot of oxidative stressors. So jumping to a high pressure is not going to be a good idea.
Right, for sure. Talk about mitotherapies.
Yeah. So everyone has heard of like inflammation, anti-aging, all these different buzzwords that pop up in the longevity or even just like optimizing your health realm. And one of the newer buzzwords is mitotherapies. And instead of reducing inflammation, which a lot of what we do here, we're also looking at the other part of that foundational level of the triangle is improving energy efficiency and energy demand. And of course, most of the therapies that we target here are the mitochondria. And so now there's this field of research. I shouldn't say now because it's probably within the last 5-10 years, but now it's starting to trickle into our radar and to our patients' radar. But a lot of these are designed towards increasing the amount of output ATP-wise from the mitochondria. So you've probably already been familiar with these things. We have a lot here in the office, one being, the lasers, photobiomodulation, red light therapy, hyperbaric is a huge one. You'll see NAD injections, and then methylene blue as well is another mitotherapy. But of course, in this population, we're also looking to optimize what we have at hand, and then also from a time standpoint, what's going to be best for these kiddos. So the way that hyperbaric really works is the body is this adaptation machine. So as you start to feed it more input, it's going to optimize itself to be able to process more of that oxygen or more of the light. So that way it can convert it into the usable energy that is ATP. So while we're shining these lasers on, your child's brain, while we're getting them into the chamber, the body's going to respond by not only making bigger mitochondria, but more mitochondria. And that's really what's going to be a long-lasting effect and, carry much beyond the office and things that we're doing here.
Yeah, and it is really interesting of like even just looking at laser therapy, and you were talking about it in the same realm with hyperbarics, is like a lot of these kids, you have to start off on a really low dose and like a low amount of time and a lower amount of joules getting to the brain. And as they become more efficient, you can increase that, and you can use more and more powerful wavelengths or different wavelengths that can get deeper. So going from, that violet to green to red to eventually infrared, even within a week, a lot of times you'll laser a kid on infrared and you'll be like, wow, they didn't have a great response to that. But then if you start with some of these lower wavelengths that can't penetrate as much or don't have as much power, they respond really well to those. Then eventually you can get to one that actually is able to get to the brain a lot easier and with a lot more power to it. And then they respond really well to that. But a lot of times they have to build up to that just simply because they don't have efficient enough mitochondria or enough mitochondria.
Yeah, so true. And I actually just wrote a blog that talked about these 3 different studies. See if I can remember all of them, but 2 of them for sure. One specifically in the brain this has always been theorized, but now they're actually able to demonstrate this, that one, there's different regions of the brain that have not only different types, but different numbers of mitochondria. So that really speaks to some of the symptoms that we'll see with these different brain regions and why they do improve when you're really specific with lasering this part of the brain versus that part of the brain. So that was a really cool finding that they demonstrated. Another one, and it also kind of speaks to why we see certain symptoms in neurodegenerative conditions and why they affect certain areas of the brain or certain functions too.
Was there more mitochondria in certain areas and less in other ones?
Correct.
What areas had less?
I didn't go specifically into that, but I would be willing to bet that it makes sense that the cerebellum or brainstem, being that they're really tightly wound and have so many more neurons, that those would be the
much
areas.
higher densities.
Yeah.
That have pathways you use more often or the most often or through movement or whatever it may be.
Yeah, exactly. Then there's another study that demonstrated that the mitochondria through 3 mechanisms can transfer its mitochondria to cells that have other damaged mitochondria. So specifically in like neuroinflammation, if there is a cell that's being inflamed, isn't super efficient at producing energy, that's why when we are also lasering these spots or, applying hyperbaric, we are building up these mitochondria to then go and really heal itself.
They can transport to other injured cells. Yeah. That's wild. Because there's just a ton of research on, hyperbarics also, but like photobiomodulation and, injuring or creating neurogenesis and, new cells and all those types of things, which I thought it was just super wild when I first read that. But once you start to learn about how they affect mitochondria and energy production, it's like, well, yeah, it makes perfect sense why you would be able to develop new neurons and new cells and things, or the body would be able to, not you, but your body uses light just to do that in the first place. So
Yeah. Yeah, it really speaks to the innate intelligence. I mean, a lot of us think about when we eat food, that's when our, stomach acid is breaking it down, and then eventually it's getting into the raw materials to then create energy that way. But we can also do it with light, we can do it with oxygen, and just convert a lot more utilizable energy at a really high rate of return as well.
yeah, which is so cool.
I do remember the last study. The last study was a little bit more of a Frankenstein one, but they were using stem cells to be able to manufacture more mitochondria. And what they were doing is demonstrating that these stem cells could not only specifically targeted, could not only produce more but bigger ones, but also mitochondria that could produce so much more efficient ATP.
Interesting.
So that'll be really, really fascinating to know down the road. Kind of how some of the outcomes of more studies.
Yeah, for sure. And there's so many of these cool things coming out, and every year we feel like we learn more and more, and there's newer and newer therapies. And the thing is, like, it's kind of funny that all of this is starting to come out, but like a lot of these therapies have been, I don't know how long Hyperbarics has been around. I've known about it for obviously a long time. It's been here for much, much longer than that. But like photobiomodulation modulation was developed in like the 70s, 60s, 70s in Russia, and it's like these therapies have been around for so long that have been known to address many of these underlying mechanisms of health and illness, really, in all forms, but they're not widely used, which is incredible.
Yeah, or at least here in the US. It's like, I know specifically in dentistry, red light therapy has probably been used for over 100 years. It's got to be one of the most researched therapies on PubMed.
Yeah.
And I know when we were studying hyperbaric and getting certified for the higher pressures, we were out in New York, and we had learned about hyperbaric was theorized back when they were building the Brooklyn Bridge, because when they were having to go down far into these elevator shafts deep underneath the surface, you were in a pressurized environment naturally, and some of these workers were getting banged up, broken ankles, pretty severe job, site stuff. And they noticed in one individual particularly that his ankle is healing so much better when he was down in a pressurized environment. And I don't know if that cascaded into the iron lung, which is a little bit different form of hyperbarics, but these mechanisms, like you said, have been known for quite a long period of time. And now we're just starting to get the data on all of these different use cases and applications for them.
Yeah, which is super cool. And I think, I mean, to be honest, like a lot of these therapies are the future of what, medicine will be, because they address so many of those underlying mechanisms that you can't get through other ways that we know of, at least currently, or at least I know of. I'm sure there is other ones that I don't have any clue about, but it's just super cool to see how they work now and in the future, as that continues to get better and better and the research gets better and better. It'll be really cool to see what comes of it, for sure.
Yeah, just on the mitochondria in general, I think that's such a unique position to be focusing on, is like the energy production as a start point, and then, as we talked about, the neural inflammation and neural autoimmunity as that end point, and how that really trickles into so many different chronic disease states. Whether, like we were talking about the other day with pregnant moms and having symptoms that you typically think of pregnancy, of had nausea, vomiting, they're theorizing that that's mitochondrial dysfunction. Of course, you have so many different really good videos out there on mitochondrial dysfunction being issues as a root cause of autism. I think it's really, really fascinating, because it's so, we're so quick to jump to some of these high level therapies without really addressing some of the foundational issues that really make a huge impact in the long term.
Yeah, and when I first started learning about that, it was like, oh my gosh, this makes so much sense, just simply from the aspect of like all the toxins in our environment. And when you start digging into all those and seeing if they're mitochondrial disruptors, that they're literally all mitochondrial disruptors. Like, well, no wonder we have so many issues that are mitochondria. Like, we're putting all these things on our skin that are mitochondrial disruptors. We're drinking water that's full of herbicides and pesticides that are mitochondrial disruptors. We have all this particulate matter in the air that are mitochondrial disruptors. And it's just wild to think about how many of those things are mitochondrial disruptors. And it's like, well, no wonder we have all of these issues with our mitochondria that are really the starting and jumping off point, because Our whole environment's set up to just trash these little guys that literally make us live. It's really, and also then we're not doing any of the things that build our mitochondria. Like kids aren't playing 5-6 hours a day to build their mitochondria. They're not getting out in the sun to build their mitochondria. And they're not exercising and breathing enough to build their mitochondria. They're not eating appropriate foods that build their mitochondria. So we have all these things that are just depleting our mitochondria tremendously and nothing on the other side to rebuild them. And when I first learned that, I was like, oh my gosh, that's just insane. And then I started looking at the research, and there's just an absolute ton of it. It's crazy. So
yeah. And even as I was looking at it, just a little bit of data last night, it's like even into some of the mainstream, like the Nature articles, they're looking at autism as a mitochondrial dysfunction.
Yeah,
in a majority amount of them. And
I know, and say other big frontiers in neuroscience and all these big publications. I know it's crazy. It's right there. It's right there in front of everyone's face, and and they're looking for all these other strategies or things that you can do or ways to adapt around it, when really the therapies should be targeted towards these underlying mechanisms.
Yeah.
So,
yeah.
And I think people will see this and get to that.
Yeah. And I think that's why we see a lot of the outcomes that we do, is because just keeping it simple and real, not that it is simple, but
it really
focusing on the pyramid as just your guiding framework. It's
just
huge.
Getting that foundation of energy, and then working on getting the energy back, and then working through normal neurological development. It's like, it sounds so simple. I mean, it's not that easy, but it's profound. Like, just the changes that start happening, it's really cool. And it doesn't take that much, to be honest. I mean, it takes an intense amount just to get the ball rolling, but then once you do, it's like all these things just start clicking into place after it. And then just educating the families on, here's things that you need to avoid, here's things that you need to do to support those systems is gold.
Yeah. I think we have a large benefit too of, in most cases when kids are reaching out or parents are reaching out to be able to schedule their kid, we got about 2-month, 3-month wait list right now. And so we have the liberty of taking a little bit of time to prep our, these kids for the intensives, really work on their energy production systems, really work on reducing inflammation.
Get some labs ordered before they come so we know what's going on. And yeah for sure. And that's huge.
Yeah.
And so it's not just time wasted, it's just time spent on making their bodies more efficient, and they're going to be able to handle way more when they get here.
Yeah.
Build more mitochondria.
Yeah. And one of my biggest takeaways from some of your courses has been, we got to treat these kids like professional athletes. Like, especially as we're, as people are going through, like the NFL, for example, you go through the combine, you typically have a nutritionist, you typically have someone running labs on you, taking all of these supplements, really priming your body and priming your brain for this high level of performance. When a lot of these kids, this high level of performance is their daily life. So taking the time to really optimize all of those systems is, again, why I think we get the outcomes that we do.
I agree. And looking at all the things that just aren't looked at, for sure. Thanks for your time today, man. Appreciate it.
Thanks for having me down this week.
We should have many more of these conversations. These are fun.
Could have filmed one on the run the other day.
Yeah, we should have.
Would have been a lot more huffing and puffing.
It's going to be our next thing. We're going to set up a thing where we go on runs and then we just record everything. And great conversations had there. Cool. Well, thanks for your time, man, and we'll talk to you next time.